Hello, everyone. This is Dr. Karan from Dr. PK Life. I'm a board certified internist in California. I've been in practice for 30 years. And here on this channel, we're going to dive into a real health topics that affect you and your family. So today we are talking about something silent but serious, metabolic liver enzymes. I see that very often in my clinic. It is a hallmark of metabolic disorder people are facing. Up to 50% of population they're facing metabolic disorder and elevated liver enzymes and fatty liver. They are usually showing up in the labs and patients are getting worried. So we're gonna break it down, what's causing it and how we can fix it. Don't forget to like this video, subscribe, and drop your questions in this chat, and I'll answer them at the end or later on. So, what are liver enzymes? Liver enzymes are proteins your liver makes to help with metabolism, digestion, and detoxification. The most commonly elevated in ones are ALT, is called alanine aminotransferase, is specific to liver. AST is called aspartate aminotransferase, also found in muscles. ALT and GGT, they are linked to bile flow issues. So, why they are elevated? So, I'm going to talk about the top reasons for elevation of liver enzymes. One is called non-alcoholic fatty liver disease, very common in those with obesity, diabetes, or high cholesterol. Alcoholic liver disease, heavy alcohol causes fat buildup, inflammation, and scarring in the liver. Medication and supplements, statins, acetaminophen, that is Tylenol, even some vitamins like high dose of vitamin A or kava, which is supplement, can cause elevation of liver enzyme. Viral hepatitis A, B, and C, silent infections that damage liver cells. Hepatitis A is really acute situation. Hepatitis B is really chronic condition, and hepatitis C is a chronic condition. Other causes could be autoimmune disease, could be celiac or thyroid disease, and genetic conditions like hemochromatosis. Most people with elevated liver enzymes feel fine, and that's what makes it tricky. But if the liver damage progresses, then you should look out for fatigue, jaundice, which is yellow skin or eyes, dark urine, pale color stool, abdominal pain, loss of appetite, and itching because of accumulation of bile acids. So, how do we diagnose it? When enzymes are elevated, your doctor is going to order some blood tests for viral hepatitis, autoimmune panel, iron studies, copper studies, ultrasound of liver, or maybe CT scan of liver. In some cases, we also order fibro scan to see how bad is the scarring, and sometimes even liver biopsy. So, how do we treat it? Well, it's the lifestyle changes that usually fixes the problem. So losing weight is the number one treatment for elevated liver enzymes if it's not because of alcohol. So if you lose the weight about 10% of your body weight, current body weight, your liver enzymes are going to drop significantly. You got to eat liver friendly foods, high fiber, low sugar, lean protein, healthy fats like olive oil and nuts and seeds. You got to exercise 30 minutes every day, at least 5 days a week, and that could be simple walking. Cut out alcohol as much you can. You got to manage your diabetes, control your diabetes, bring it down somewhere close to 6, 6.5. Manage your cholesterol and manage your blood pressure. And if you have viral infection for hepatitis C, we have a cure now. So your doctor can send you to hepatologist or gastroenterologist, and they can usually give you a tablet after doing some test. And the treatment usually is for 3 months. You got to adjust some medications, which may be causing elevation of liver enzymes. And you may need corticosteroid like a prednisone If it is autoimmune, you can do starting today. Maintain a healthy weight, eat healthy, eat in the morning, eat in the afternoon, and that should be your main meal. So eat like king for your breakfast, eat like a prince for your lunch, and eat like a beggar, a pauper for dinner. Dinner should be the smallest diet. 40% of your calorie should come from breakfast, 40% from lunch, only 20% from dinner, and that should be mainly greens and vegetables, nuts and seeds, and small amount of protein, could be meat or tofu or lentils. So limit your alcohol. It is directly toxic to your liver. Be cautious with medication like Tylenol. You should not be taking more than 2,000 milligram a day in any case. But if you are on medication concurrently, which can potentially affect your liver function, um, like antifungal medication or cholesterol lowering medication, you got to talk to your doctor. Get vaccinated for hepatitis A and B. Stay active. Avoid processed food and frozen food, and fast food and sugary drinks, including diet soda and energy beverages. Practice safe sex, clean hygiene, regular health checkup. Your liver is your body's detox powerhouse. It doesn't complain until the damage is already done. So, if your liver enzymes are high, don't panic. Take action. With the right lifestyle, most liver issues can be reversed or managed. If you found this helpful, click like, subscribe, and share it with your someone who may need this information. Comment below if you had ever been told before that your enzymes are elevated and what worked for you. Now, there are some herbal supplement can help you, and Dr. PK Life have this product called milk thistle. The milk thistle complex has mushroom, milk thistle, flaxseed, artichoke, gentian root, turmeric, dandelion, resveratrol, green tea, ginger, berberine, anthocyanins, copper, selenium, iron, and multivitamins. You can try that. Thank you very much for watching.